reiterate to my team a lot, and I also remind myself a lot about, is that he told me, don't ever judge someone that has completely neglected their teeth. Because a lot of times it's because they always hated their teeth. When you hate your teeth and you hate, everything about your teeth, you don't take care of your teeth. So the reality is cosmetic dentistry, straightening teeth with Invisalign, and getting people to love their teeth improves their health because they're going to actually take care of their teeth.
Angels and demons fighting in the deep end. I turn all my weakness into something I believe in. Every scar, every doubt, that's fuel when I speak. Welcome to the battle where the broken get free. Yeah.
Welcome to Angels and Demons podcast, to another episode with Dr. Michelle. Dr. Michelle, welcome to Angels and Demons podcast. So good to see you. Would you be so kind just to tell us a little bit about yourself and why you became a dentist?
I was raised by a dentist. So my dad is a dentist, and I worked in his practice from middle school all through high school and college. And when I went to college, the only thing I was certain of was that I was not going to be a dentist.
Wow.
Yeah.
You were certain on that.
I was sure of that. I didn't know. I wasn't sure of anything else.
But you
I was
became
sure
a dentist.
of that. Yeah.
What brought about the drive to go that way?
I was a biology major, and I loved, the discovery process of figuring stuff out and doing research. And then I worked in a research facility, and I decided working with the same 8 odd people all day, maybe never finding anything out, wasn't really going to work for me.
So you were like, this is the route.
Yeah. No, so senior year, I went back not knowing what I was going to do.
Wow.
I went to the Career Counseling Center and kind of figured out that healthcare was a better avenue because of working with people and not being trapped at a building. And
what dental school is this?
Dentistry came up. No, I was an undergrad.
Undergrad,
at the
okay.
time. Yeah, trying to figure out where to go.
Wow.
So yeah, and then I figured out dentistry made the most sense.
That's so cool. So
Yeah.
you kind of like, when you found out that dentistry made the most sense for you, even though it wasn't something that was at the forefront of your mind and wanting to do.
Yeah.
Was your dad proud that you decided to end up going in that direction?
He was at first very stunned because everyone was really clear that I was not going to dental school, including all my friends from college.
Wow.
Some of whom felt bullied and badgered about their choice to go to dental school. So yeah, it was
sympathetic.
Entertaining for everyone.
That's incredible.
Yeah.
So through that, so after you did your undergraduate, what spurred you to go to the dental school you went to?
Well, I was from New York State. My dad went to Buffalo, so
wow,
it was kind of a natural.
That's a lot of snow up there, isn't it?
Not near the school, more near the stadium.
Okay.
Yeah.
I've seen them
a lot more
shoveling it when you go to a football game. They're like, bring your own snow shovel, just to sit down. It's
the
like
stadium
pouring
makes
snow.
the news, so that's why.
That's awesome.
Yes.
Did you go to a lot of games?
Oh, yeah.
So you're a Buffalo fan.
Yes, I am.
In and out.
I am.
That's so cool.
Yeah.
That's so cool. Well, thank you. I really appreciate you coming on because this podcast is strictly on, mental health. And more, I've realized that if you don't have good dental health, you can't have mental health. Not from a perspective of just being healthy, but from the image of how your teeth look, it defeats your self-confidence in who you are. And so I really appreciate you helping us walk through some things that will help people better, get their mental health in order. First, just a little bit more about you, maybe about your dental school experience, and how did you enjoy that?
I enjoyed Buffalo. I mean, Buffalo Dental School has an amazing legacy, and it's a very good school. It was nice, right, to spend time with my dad's colleagues, and I enjoyed Buffalo as a city. I was ready when I got to senior year to leave. I was raised in an environment of comprehensive care and taking care of patients and focusing on their health. And, dental school is the thing that you just have to get through. So it started to bother me, that that the dental school patients maybe weren't getting taken care of comprehensively. Now, they were getting very good care. I was just ready to move on.
Because you knew
to real care.
That's really cool.
Yeah.
That's really cool. So you saw what the need was, and you're like, listen, I want to create a comprehensive, effect to take care of these people.
Yeah.
Not just the way that they were instructing how to do it.
Right. Yeah, because dental school patients just fall victim to like whatever the next student needs to complete, like check off your list.
That's an interesting concept.
Yeah.
So when you got through that, did you open a practice up in New York, or did you what did you do when you got out of dental school?
Well, my dad's an incredible dentist. He was number one in his class. He's an amazing human and a really good dentist. And so, yeah, I went into practice with him. And
what a blessing.
Yeah.
From not thinking he's going to have anything, you're not going to have anything to do with it, with working with his daughter. That's pretty cool.
Yeah, it was amazing.
I bet that just was like, there probably was some special moments there.
Yeah, it's challenging, right? To
work with family.
To work with your family.
Yes.
But, he was an amazing mentor. He taught me a ton about, he's such a good technical, clinical dentist. He taught me a lot about that. He's also really good with people and patients, so I learned a lot about that. Now, I worked with him all through school, too, so I listened to him talking to patients when I was growing up, and I was his chairside assistant a whole bunch.
Wow.
And I was, the office manager some summers. It just depended on, whatever he needed in the office. When I was working there, I would do that thing, other than hygiene, of course.
Yes, ma'am. Did you end up taking over his practice at one point?
That was the plan, but then I met my husband and moved to Florida, so I kind of ruined that retirement plan.
So what year did you move to Florida?
2002, right the week before I got married.
Oh, okay.
Yeah.
So then you started a practice here in Jacksonville.
No, my husband's a dentist, so.
Your husband's a dentist?
Yeah.
That's so cool.
Yeah.
You know this language in and out, dentistry. So you speak it from a childhood perspective to a real life perspective to everything. You know this in and out. No wonder you, as a dentist, are so comprehensive in everything you do. Like your practice is so comprehensive. I mean, going to your website and seeing Jax, Beaches Dental, you see everything from such a comprehensive standpoint. How did you gain that knowledge?
Well, I mean, some of it, right, was how I was raised. So I was raised in an environment at my dad's office of private care and putting patients first, not putting, the limitations of their benefits. We were, a private practice and not contracted by any insurance. And that's what I was taught was in the best interest of the patient, because you're discussing with the patient what is going on in their mouth and what solutions would be best for them.
Not letting insurance dictate treatment.
Yeah, not leading with that. And so because I was raised that way, that sort of set me up for where Jax Beaches Family Dentistry is now. We're a complete health practice because that's how I was brought up.
That's really incredible, because Jax Beaches Family Dentistry calls itself a complete health dentistry practice. What does that actually look like in real life when a patient walks through your door?
Well, it starts with the medical history. You and I were talking off camera about how important that is. So we think of ourselves as medical partners with all of the amazing people after being in the Jacksonville Beach area for the last 12 years that I've built relationships with. So concierge doctors, chiropractors, acupuncturists, I think of myself as being sure that my patients' teeth get fixed well, but if the rest of their body's not healthy and they're not following up on things to care for themselves, to me, it's not as impactful. We often see people 3 to 4 times a year, which is something that no other health practitioner can say. People don't consistently see anyone else that often. So when Mrs. Smith says that she was supposed to go get some unusual symptom checked at the doctor, and I then see her 3 months later, we can have a conversation about how it went, and I can be her accountability partner about being sure that she takes care of herself. And then, the more that we see, A-grade research about how important, periodontal health is to heart health and dementia prevention and all of those things, once we know that, we are then obligated, I think, to be sure that the patients also know that. We used to ignore bleeding gums as an industry. We used to watch periodontal pockets. We just don't do that anymore in our office. We're more assertive about being sure that patients know the consequences of not getting that stuff under control.
That's amazing. That's amazing.
And then in terms of the
collaborative approach
yes.
with the whole entire industry of medicine, not just dentistry over here, medicine over here. You've combined it holistically all together.
Right.
That's really beautiful. Because most people, I feel like they go in when something hurts.
Yes.
They don't understand necessarily the benefit of going in routinely.
Right.
And what would you say is the importance of why it's so critical to go in routinely and not just when it hurts?
Well, yeah, people, and I've had mixed reviews of this next statement, but I'll say it anyway. One of my biggest complaints, to the creator, whoever you believe that is that dentistry has no symptoms. It's symptomless. So
that's interesting. It's symptomless.
It is. And so my complaint is I think it would have been a better design if when you got a cavity or you were starting to get decay, a little more sensitivity earlier on would be nice. Because then people would be motivated by that, right, to come in more frequently. So the reality is that one of the things we did in a very sort of decidedly way 10 years ago is we stopped asking people when they come in for cleanings if anything is hurting.
Wow. That's powerful.
We never say it. And the reason we never say it is because when you sit a patient in the chair and that's one of the first things that you ask, you're reinforcing to them that the only reason they really need to come is if something is hurting. And you're also reinforcing that the only reason they ever need to have dental treatment is if something is hurting.
That's very interesting.
So we, practice-wide, that question has been deleted.
I love that.
Yes.
I saw on the front book of a textbook, periodontal disease is the painless disease. You know, and so you make an excellent point. If you're waiting for pain, your
it's
problems,
never gonna come.
Yeah, your problems are never going to come. Essentially,
right.
That's very, very
Until
interesting.
your teeth fall out.
Yeah, it's just something that I find so many people say, it's not hurting me, so why should I do anything about it?
It's a good It's a valid question.
And what would your answer be if someone has, like a cracked tooth or, has bleeding gums, and they're like, it doesn't hurt, it's not bothering me. Why should I take care of this?
Well, I take a deep breath and, again, educate them that unfortunately or fortunately, depending on, what side of the coin you're on at the moment, every disease in dentistry is symptomless. There is no symptoms.
I think that's a really key point
problem.
You're saying there. Yes.
Yeah. I mean,
it's symptomless.
Cancer can be symptomless too.
Till stage 4, till you're literally dying. I hear that all the time. We caught it in stage 4. I felt great until stage 4, and now I have like 6 months to live.
Exactly.
So, you offer services like sleep apnea treatment, laser dentistry, the facial aesthetics. How did you decide to expand beyond traditional dentistry? I mean, you kind of, in a way, explain that, but you're very different than everyone else in the town, so to speak. Your approach is very it's very different, and where
a lot of people.
You're looking at someone and instead of like number 3 needs an MO and we're giving reference to a tooth needing maybe like a filling. Mm-hmm. I'm not using layman terms here, but what has enabled you to create that to where you saw, like, I mean, it's amazing. You have the people around you are incredible. You have professional sleep apnea, which the power of sleep, Dr. Martin was on here speaking about. Incredibly brilliant man. And then you have acupuncturists, you have sleep specialists, pain specialists, like medical doctors. And I don't think most dentists are even capable of understanding that. What gave you the gift or ability to be able to do that? Would you say your dad was part of that, or did you kind of discover that through your husband, or?
It's a combination of a lot of things. I mean, some of it had to do with some coaching that I was doing that was based on the platform of Complete Health Dentistry, but then a little bit of it too is my own story. You know, I don't have a single cavity. However,
Wait, you don't have a single cavity?
No. However,
how did you do that?
Well, it's genetic. So the next thing I'm about to say is,
Wow.
however, I ended up with pretty significant periodontal disease. And
have that too.
Traditional dentistry was failing me. I was very uncomfortable about my mouth odor. I had recurring deep pockets. I was concerned enough where I was headed to the periodontist, maybe needing periodontal surgery, assuming at some point I would lose some of the teeth on the upper left. I never liked my smile. I felt like my teeth looked old and dingy and yellow. I wasn't sleeping well. I have always been a snorer. All of those things were kind of crashing down around me. And when you're a dentist, you want to be healthy, look healthy, you know, put a good face on. And I really did feel like dentistry as an industry and traditional dentistry was failing me. I went to a Complete Health Dentistry conference convention and found out about the PerioProtect tray technology. I was the first patient like 8 years ago in the practice, and it saved my life, my teeth, my attitude towards dentistry, and gave me a tool that just isn't like any other to confidently get people's mouths healthy and quickly.
Thank you for sharing that.
Yeah.
That's very very open, and I think that for a lot of listeners, that's very encouraging to hear a dentist open up and just share personally your own story there that motivated you to want to give back to others in a comprehensive way. You mentioned the PerioProtect trays. For those that don't know, PerioProtect is a peripheral seal with a hydrogen peroxide base that creates oxygen, essentially, and the bacteria underneath the gum is anaerobic, right? So it kind of creates a bubbling effect, and because it's a peripheral seal, top and bottom, you wear it for 15 minutes in the morning, 15 minutes in the evening. It bubbles up, hits the top of the tray, and through compression, pushes the fluid down underneath the gum, and essentially, through suffocation technique, kills the bacteria along with getting rid of the bad bacteria. Would you say that's kind of an idea of what it does?
Yeah, it's like a hyperbaric chamber, and also, you know, increases capillary growth, which is really helpful for smokers.
Wow, I didn't know that.
Yes, it is. And even, I mean, the whitening is breathtaking, honestly. And that's just a side effect of the daily peroxide use. But I have several.
Beautiful white teeth. Who doesn't want that?
That's right. And within 3 days, all mouth odor is completely eliminated. So
Isn't that incredible?
yeah, so now I can get close to people. I'm comfortable with, you know, my breath and my smile.
And
yeah.
this was 8 years ago when,
Yes.
wow. What was that like being in an event like that really you finally, like, hook, line, and sinker, you found something that you were like, for your practice.
I was
like,
overwhelmed.
You were overwhelmed?
It was like, as soon as she started to speak, I was like, oh my gosh.
I've been there. I'm not laughing. I've been.
That is the solution. And it really was. So, yeah, it's amazing.
Yeah, I kind of had that same feeling
Yeah.
when Dr. Martin was speaking, because I didn't realize, because I snore, I didn't realize when he was talking about like the straw closing and your airway going off, I was really kind of scared. Like I was like, that's me, you know?
Mm-hmm.
And so I was, you know, it's a lot to take in at first, because you're like, that's me.
Yeah, that's right.
So I should probably do this.
Yeah.
Which, makes such a powerful difference when
For
you
sure.
bring those things into your routine, because it addresses, those asymptomatic symptoms, like you said. Like, there are no symptoms, but you're addressing them, and they do have very serious consequences, like you said,
Absolutely.
on your body.
Yeah.
Dementia, heart disease, and the list goes on and on. With over 50 years of combined experience on your team, what's one major change you've seen in dentistry for better or worse? And I mean, like,
I know.
for because with your dad, with all that you have been saturated in, you're very rare. It's not like you just came and went to dental school. You have so much knowledge, and I can only imagine the textbooks surrounding your home. It's probably just like, you probably have bookshelves with just like books everywhere. Like, what is something that's come in for the better or the worse?
I would say the biggest thing is the understanding that we now have that airway issues and disordered breathing and the clenching and grinding that goes along with it is the main reason for the breakdown of people's teeth, the destruction of beautiful dentistry that they've had done, and also the changes in the oral microbiome. When you're a mouth breather and a snorer, and you are doing that night after night, and a lot of times mouth breathing all day too, it's the primary reason for the breakdown of the environment. And even 15 years ago, we didn't know that. And it's the whole, now that we know better, we all need to do better. So it's the same with, can we just let people basically have an open wound in their mouth and have bloody gums? Sure, we can, but we all know that having that bacteria in the bloodstream, because we only have one circulatory system, isn't good for us. We all know it contributes to dementia and
That's
heart
fascinating.
disease. We also now know that when people are clenching and grinding, when they have huge tori, when they, have an oral microbiome disbalance, we know that that's from an airway disorder. So now that we know that, you can't unknow it. So then I feel like you're obligated as a healthcare professional to do something about it. Even if all you do is refer them to a beloved dentist that does airway stuff if you don't want to do it. It's fine if you don't want to do anything about it, but you are obligated to screen for it.
That's incredible.
Yeah.
I think it screams through the mic here how much Dr. Michelle cares for her patients. When you come in the door, you are comprehensively treated for everything that you might need to live a healthy life, not just for one thing or the other. She surrounded herself with pretty much every medical professional there is to ensure that patient has everything they need, whether it's a sleep disorder, whether it's, bleeding gums, whether it's, structural cosmetic stuff that's interfering with their mental health because they just want their teeth to look better, Invisalign. That's really a blessing that you can give that to them and provide that for them. Because I feel like a lot of dentistry's become just a one-way road. And so what has been the biggest part of collaborating with everyone that you have really appreciated?
Well, I was always in a group practice right from the beginning, right? So I worked right away out of school, went straight into practice with my dad. So I had access to him, and he's incredible. And he also went to school, and there were no specialists. So
That's very interesting.
Yeah.
No specialists.
No, not really.
So they
There
pretty
was
much
oral
did
surgeons.
everything.
Yeah.
That's what my dad said, because he's like
Yeah.
78. He said they pretty much did everything. Like he had, instead of gutta percha and the root canal, he had a post. What is it? Where it's
stainless steel. It was just different technology.
Yes.
Yeah. But there were no endodontists. So because of that, right? Our predecessors were more comprehensively trained. So I went into group practice with him. I went right from that to practicing with my husband in a practice that was even bigger. So there were like 3 or 4 of us together. And then I've just kept that on. I mean, and actually in my hometown too, all the dentists in town were in one building. They built a building together.
That's really cool.
So there was there wasn't a
community.
competitive spirit. It was a collaborative spirit. So, right next door to me was the oral surgeon and the orthodontist, and then the periodontist was, right at the other end of the building. And then there were other general dentists in the building. So I've always been in a collaborative environment right from the beginning. And then as soon as I became more interested in collaborative care in terms of medical professionals, I just love to network. I love hearing what other people do. I love hearing what other people can do to impact the health of my patients. So I have relationships with all kinds of people, multiple acupuncturists, health and wellness, holistic doctors. I'm interested in it.
That is incredible, and the impact that has on the patient is amazing. You can offer them an experience that very few dentists can, because you're willing and open to be able to provide a comprehensive approach, even if financially that doesn't necessarily add to your benefit. You still are so set on taking care of the patient in the right way, because those other people have to be in the circle as well.
Yeah,
you're amazing, Dr. Michelle.
Oh,
I mean, that's really that's very, very professional of you to take care of someone so they can spend more time with the people they love in life. And if they're not healthy, like Steve Jobs said, the most expensive bed is a hospital bed.
That's true.
So you're really hitting the nail on the head with just addressing the health needs. And with the circulatory system, if you have an infection in the mouth,
it's circulating.
It's definitely doing damage to other parts. Your practice emphasizes calm, comfort, and compassion. And why do you think dental anxiety is so common? How do you personally help patients feel safe?
I think a lot of it is just our approach, and then also how how you intake patients, I think, is important. So we do obviously an interview over the phone and try to gather as much information as we can talking on the phone. When they get into the office, we also do a new patient interview. And what we're really looking for in those instances is, what are people's barriers? Why are they switching dentists? What bad experiences have they had in the past? So that we know up front what the patient's concerns are. And, as you know, because you're in dentistry, a lot of times people have had such a bad experience that, sedation is the only way that they're going to get through it. So, and I've been doing dentistry for, a hot minute. So
how long would you say?
I don't really want to say.
Oh, okay.
I'm just kidding.
I mean, just because
35 years.
Wow.
Yeah.
Wow. That's a lot of wisdom right there. To be able to offer. It's not like you just started yesterday.
No, I definitely did not just start yesterday.
It's like you've had the textbook experience, and then you've had the actual world life experience,
Yes.
and so you're.
I've had a lot of both. Yeah.
So IV sedation, you were saying, is something that can help someone feel safe.
Absolutely. And the safe environment, I think, comes from people feeling heard and meeting them where they are from the beginning. I definitely focus as much as possible, even when patients try to bring me back to, oh my gosh, I'm so embarrassed, or oh my gosh, I should have done this sooner. I really try to get them away from that feeling. It's important.
How do you do that?
I just tell people, we can talk all we want about what you should have done, but we are where we are.
That's a good point.
Most of what you have going on is fixable and simple, especially because almost everything that people need to have done, we can confidently do because I have multiple providers. When you have multiple providers in an office who all have different talents, all have different passions, all have different skills, no matter what the patient presents us with, we can confidently take care of it. And we can take care of it in an environment where I'm not forcing myself to do some dental procedure I hate. I have someone else do that.
What's a dental procedure you hate?
I don't do any surgery. Yeah,
okay.
I don't do surgery. I don't like surgery.
Would that be like, it could be
I don't
extraction?
even like blood. No,
Okay.
I don't do blood.
So that is not your
I don't do
forte
blood.
or
No, I just don't like it.
Okay. Okay.
And I don't think I should have to do dentistry. I don't like to.
Well, after 35
Yeah.
years, you don't have to.
Right.
I mean, you can choose to do exactly what you. That's very interesting. So that part is what a luxury. I mean, because I can't tell you how many people come in the door and they say, one, I've had a bad experience, and number two is nobody's ever told me this before. Now, when someone comes in and they're like, nobody's ever told me this before, what do you say?
I tell them, I mean, it depends on what they're saying that about, right?
For an example, like, I feel like a lot of people in dentistry, it's almost like they're shopping around like they're at a pawn shop. You know, like, I want my free cleaning. My insurance covers this. If I don't get this, then I'm out the door, okay? I don't want anything that my insurance doesn't cover, okay? And that's how you look at your health. But you go to Starbucks, I want whipped cream, I want cherries, I want sprinkles, I want extra shot of mocha, espresso. And you go to your life and your dental health and you're like, this is where I draw the line now. You know what? This is my budget comes in, But the Gucci purse, that one's fine. Like, what is that? Why? I don't get it. How do you explain to someone that says, nobody ever told me this? Like, is it a non-confrontational thing?
Let's say it's about gum disease, right?
Okay.
No one's ever told me I had bone loss. No one's ever told me I have inflammation. No one's ever told me it's important to not have bleeding gums. Why are you just bringing this up now? I have a tendency to go back to, well, there's two things. I was raised by my dad, and he felt very strongly about not being disparaging to any other providers. So we actively had a lot of language that would allow us to work around that. The main thing just being like, everybody has a different approach. I have had training that makes it very clear about the negative effects, especially on your overall health, of this disease that you do in fact have. And so I feel obligated to let you know about it.
That's awesome. What we see today, regardless of what someone said, did not say, whatever, is besides the point. Today you're in front of me, and this is what I see today.
This is what is.
This is what is.
Yes.
And then therefore, you honestly go and tell them exactly, here is what your needs are. Here's the comprehensive treatment plan. It's like it's always been funny. It's like, not funny, but I'm saying when someone gets like cancer, you don't say, well, methotrexate, doxorubicin, prednisone you need maybe to treat your T-cell leukemia. But because you're on a tight budget, we're just going to try the prednisone and we're going to leave off the other drugs, You treat it comprehensively to put the cancer in remission. And your whole approach to dentistry and dental needs is comprehensively, and even if they've had post-traumatic stress, from, the slow, my dad always said the slow speed was a thing you pumped with your foot,
yes.
And that sound and stuff. So you offer the sedation, if someone needs that.
It's very helpful, yeah.
For them to get over that part. But that's a really good explanation of why, they really need to understand that when they step into your practice, they're going to be well taken care of from top to bottom.
Absolutely.
Everything is going to be in a way where you listen to what their needs are, but they're still going to get a comprehensive medical and dental treatment plan to take care of their health.
Well, and sometimes it has to be phased, but for me, like, let's say they have pretty significant periodontal, issues. I would much rather have them just sit in the trays until they can afford to get their scaling and root planing, because the scaling and root planing is going to be safer and simpler. And, what's not to like about just wearing perio protect trays for 3 or 4 months?
That's a good point. Kind of breaks up that mineral.
They've had periodontal disease for 30 years, so what's another couple months?
That's a very good point. Cosmetic dentistry often gets labeled as vanity, You know, even with Invisalign's partnership with the NFL last night at the red carpet event, you know, I saw all these NFL quarterbacks, NFL stars, Dak Prescott, Trevor Lawrence, Baker Mayfield, and they're all coming on and have done Invisalign because they've realized that doing Invisalign, where there's 1 to 2 millimeters of crowding, you have chronic inflammation, and it's giving them more confidence, you know, in their speech and in their health. And Puka, you know, who is one of the best wide receivers that plays for the Los Angeles Rams, said, you know, he's never felt more confident in his smile. Aww. And now that he gets to smile, it makes other people smile.
Yes.
And I thought, that's so cool.
Yeah.
How do you reframe cosmetic work as something that can impact confidence, mental health, and the quality of life, instead of people thinking that it's vanity or a cosmetic case, how much it contribute towards mental health?
Well, I mean, again, I hate to keep going back to my dad. If he ever watches this, he's going to be really happy. But
that's really cool.
One of the first things that my dad said to me straight out of school that I reiterate to my team a lot, and I also remind myself a lot about, is that he told me, don't ever judge someone that has completely neglected their teeth. Because a lot of times it's because they always hated their teeth. When you hate your teeth and you hate, you know, everything about your teeth, you don't take care of your teeth. So the reality is cosmetic dentistry, straightening teeth with Invisalign, and getting people to love their teeth improves their health because they're going to actually take care of their teeth.
Because their investment into their oral health is something that they're going to start to gain a value and appreciation, understanding of the importance of it.
Well, because they're caring for something that they like the looks of. When people hate the way their teeth look, even right from when they were
it's embarrassing
teenagers,
almost.
They just don't care about them.
Yes.
They don't care if they fall out. They don't care if they decay.
Or you'll hear the saying, pull it.
They don't care about them.
Yes.
Yeah.
I mean, for patients who feel overwhelmed or judged in healthcare settings, you know, what makes Jax Beaches Family Dentistry a different kind of experience in that element?
I would say it has to, you know, it goes back to the whole, you know, the spirit of, or the culture of educating people and meeting them where they are. You know, there's no reason to shame people, like I was saying earlier, about how long they waited or how bad their decay is or the fact that they have terrible periodontal disease. It's all about, okay, where are we now? What's our path forward? And which path works for you? You know, whatever treatment plan or modality we're going to use, it has to be something that the person is comfortable with. It has to fit in with their time, energy, money limitations. And they have to be excited about it too. And then they have to be able to tolerate it. Now, the advantage that we have is we're in a group practice. So it all doesn't have to be done by me. If it's some sort of treatment that I don't do, like extensive surgery, I have somebody in my practice who's an incredible surgeon and loves it. And then the same...
Dr. Martin, airway obstruction.
Yeah, I mean, it's no matter what somebody has, when they're in our office, we can do it efficiently, we can do it all under one roof, and we can do it confidently because whoever's providing the service, it's something that they love.
The best,
yeah.
You know, that's really powerful that you keep going back to your dad. And you said if your dad could hear this, I assume that is your dad with us still?
Yeah.
Okay. I really hope that he has the opportunity to listen to this because he must be so proud of you.
Oh,
because, I mean, you've really taken the things that he has instilled in you to heart. Mm-hmm. And, you know, no parent is more proud.
Now you're going to make me cry.
Well, I mean, like, I can imagine, I've never met your father, but he has instilled in you I feel like dentistry is public service for the people.
It sure is.
You know, there's nothing selfish about it. You know, nobody likes laying on their back with their mouth open, and you're very kind, you're very considerate, you're very loving, and so your dad obviously has to be that same way. because the apple doesn't fall far from the tree, as they say.
Yeah, that's
and
true.
so I really think that for listeners, when it comes to your dentistry and your dental health, when you're embarrassed about maybe this or that, or you're maybe thinking that, you're not sure because you got this or that, that Dr. Michelle is offering not dentistry, she's offering comprehensive medicine. I mean, a medicinal purpose that the whole body, not just the mouth and what's going on here, but she looks at you as a human being and that wants to be in the healthiest place possible. And you've surrounded yourself with about everyone I can imagine. I mean, you go to your website and there isn't anything you can't do. I mean, it was like you're scrolling and scrolling. I mean, it's like, I mean, you want this to this to this to this. And you mentioned, that your dad instilled that. That's precious.
Thank you.
That's really precious. If there was one meaningful takeaway point that you would want to give to patients, that they're just on that borderline of not wanting to go in. And they're almost there, but they either had a bad experience or they're embarrassed. They smile, they cover it up, or whatever it is. What would be something encouraging or life-filled that you would give them?
I think the most encouraging thing I can say to people is it's not ever as bad as it seems to you. Like when patients talk to me about why they've put things off, it's generally never as bad as they have created it in their mind. It's like all the stories that we tell ourselves that cause us to, put off doing anything in our life. You make this big story in your mind, and the story is not ever as bad as the reality of it. And the other thing is dentistry has come a long way.
Very long
a
way.
lot of people are putting off dentistry for 15, 20 years, and it's because 15, 20 years ago isn't anywhere near as good as it is today.
They didn't even
It's
have
easier.
40 years ago maybe local anesthesia, right?
It's easier.
Yes. So many ways to make the patient comfortable.
Right.
There's nitrous oxide, right?
We have all levels of sedation.
All levels of sedation. So there's no reason that you can't book an appointment, and come in and meet a loving, kind dentist that wants to take care of your needs to restore your mental health and dental health. That's so important. I think they're so closely related, would you say?
Yeah, I mean, like you were saying earlier, like what's my attitude towards cosmetic dentistry? Straighter, prettier teeth are, you're more likely to take care of them because you are happy about them, but they're also easier to take care of. So the better your teeth are, the straighter they are, the prettier they are, the cleaner they're going to be, just because it's easier to maintain.
What is one, in closing here, what is one compliment or story or something that a long-standing patient of yours has said to you that has created so much meaning to you that you just can't let go of being a dentist?
A lot of it is around, gum health and airway health. So patients that, got periprotect trays, for example, and have been struggling with periodontal disease their whole life. They've had scaling and root planing 6 to 7 times. They've had gum surgery and they still have gum disease. So people that then come in and say, oh my gosh, I wish I had had these trays 30 years ago.
Wow.
Or people that have had, severe anxiety and not been able to sleep and are so tired they don't even drive a car anymore. And you treat them with an oral appliance and they get their life back. So
that's pretty incredible.
Yeah.
I mean, to be able to be told that you've made such a difference, Jax Beaches Family Dentistry, to where somebody walks away with a clean understanding that they feel like they're in not only a strong family environment with other strong medical professionals, but they're also in the best place that can help them meet their dental needs. Dr. Michelle, I can't thank you enough for coming on and joining us. I mean, your insights, your clarity, your depth is truly going to add something to Jax Beach and already has. And I thank you so much for coming on Angels and
thank
Demons
you.
podcast and sharing, what an impact you're making on the community. This has been Angels and Demons podcast, and we'll see you next time. Dr. Michelle, thank you so much for coming on and sharing with us.
Thank you.
Stop settling for just a cleaning. At Jax Beaches Family Dentistry, they level up your smile and your health. We're talking same-day crowns, Invisalign, and high-tech care that actually connects to your total wellness. 50 years of experience right here in Neptune Beach. Are you ready for the smile you deserve? Are you ready? If so, tap the link and book now.
Angels and demons fighting in the deep end. I turn all my weakness into something I believe in. Every scar, every doubt, that's fuel when I speak. Welcome to the battle where the broken get free. Yeah.